Hello, my name's Adrian Richards. I'm a consultant plastic surgeon and the surgical director of Aurora Clinic. And today I'm going to talk a little bit about the recovery period following surgical excision of a skin lesion. So by surgical excision I mean that the skin has been cut in the full depth to remove the full thickness of the skin and the wound has been stitched. Okay, so normally the wound will be stitched internally with absorbable stitches, and these internal stitches actually hold the skin together. So the external stitches, the ones you see, are just holding the skin gently together but aren't actually doing any of the pulling work. That's done by the deep stitches, which you won't see. So the superficial stitches just to really sort of approximate the top of the skin. Okay. Now, depending on where in the body the stitches are, they'll be removed at a different time, and this is really to stop the dot marks that you sometimes get around on either side of the scar. So the old-fashioned scar will be a scar in the middle with dots on the side. The dots are caused by growth of the top layers of the skin down the sides of the where the stitches are, and this only occurs if the stitches are left in too long. And the best time to remove the stitches varies from site to site. So on thin skin areas such as the face, we tend to remove the stitches in about 5 days. On thicker areas such as the palm of the hand, where the skin's really quite thick, we can leave the stitches for up to 2 weeks without getting the surrounding dots. Okay. So when you've had your skin lesion removed, we will give you, or you should be given, an appointment to have your stitches removed. And it's very important that you do attend this, so that the nurses or doctors can check that everything's healing well and remove the stitches as planned, and hopefully give you the results of your histology at that stage. Okay, so in the intervening period, if you've had an operation on your face, it's very important to try and reduce the excess blood flow to the area. Okay, so that means in the first couple of days avoiding anything that increases blood flow, aerobic activity, alcohol, and in particular any sort of leaning down activity which puts your head lower than your heart, because that tends to cause blood to rush to the face and more chance of bleeding and swelling of the area. Okay, so try and keep your head up, a couple more pillows at night to reduce the swelling, and that applies to any area of the body. So as much as so try and elevate whichever bit as far as you can, and reduce anything that causes blood to go there. If it is tender, once the anaesthetic wears off, we tend to recommend that you just take paracetamols. That is actually very effective at controlling pain. Non-steroidal drugs such as ibuprofen and Voltarol are generally not recommended because they can increase the risk of bleeding. They can thin the blood and you're more likely to get bleeding from the areas. So generally we don't recommend those. So normally paracetamol should be absolutely fine, and if the pain is not controlled by paracetamol, we would normally encourage you to contact us, because it might be good just to check everything's okay, because normally after these procedures it really shouldn't be that uncomfortable. Okay, so we like you to keep the wound dry until you have your stitches removed, so you can shower, but just try and keep the area as dry as possible, and the dressings we use will stay on for a week. When the stitches are removed at a week, the nurse or doctor will give you instructions about how to what to do with the scar. The scar normally heals very well initially, then it will go through a red phase which lasts 2 to 3 months following surgery, and thereafter the scar tends to settle. The reason you get the red phase is the body is trying to sort of heal the area. Once the body sort of senses it's healed, it remodels the scar, and then the scar becomes flatter, paler, and eventually we would hope that the scar would turn to a very fine silvery line, which is difficult to see. And as I mentioned, we try and orientate it along a natural crease, so it's difficult to see. So surgical removal is generally done under local anaesthetic. The anaesthetic itself going in is slightly uncomfortable. Thereafter you shouldn't feel any pain, and the recovery should be fairly straightforward, but you do need to obviously contact us if you have any concerns. So I hope that's been helpful. If you would like any more information about skin lesions and their removal, please contact us either via ringing 01844 214 362 or by thanks very much for listening, and we look forward to seeing you soon.